Come in.
Hello, Mr. Petway. My name is Jamie Crear, and I'll be your nurse practitioner taking care of you today. And today I will be doing a head-to-toe physical exam on you. It will require me to do a lot of touching. So I just, if you're feeling comfortable at any time, I touch anything that hurts, just please let me know and I will stop at any time. Okay. We had already established Mr. Petway's height and weight and his blood pressure. We got all his vital signs out in the waiting room. And now I'll begin with my head-to-toe assessment. I start with his scalp. I check for any lesions, any tenderness in any area that I touch, Mr. Petway?
No.
Okay. And can I see behind? His skin color is nice. He's warm to touch. His eyebrows are evenly aligned. His eyes are evenly aligned. His ears are evenly aligned. Okay. I will check his frontal sinuses. Do you feel any pain there, Mr. Petway?
No.
What about here?
No.
Okay. He feels no pain in his frontal or his maxillary sinuses. Can I get you to open your mouth wide for me? Okay. And close. His jaw is evenly aligned. Any problems when you open your mouth?
No.
Okay. And now I will just go ahead and check his nasal passages for any drainage. And he does not have any drainage. He has some hair, but the color is nice and pink. Okay. Can I get you to open your mouth wide for me, Miss Petway? All right. Can you say ah?
Ah.
Okay. Can I get you to lick your tongue out? Okay. And can I get you to take your tongue up to the roof of your mouth? And he got nice, moist, pink mucous membranes. I see no bruising or scarring. His teeth are evenly aligned. Okay. And I check his gag reflex at this time as well. Say ah, lick your tongue out. Okay. Gag reflex is intact. And I will go ahead and test his, to see, can his taste distinguish? Can you tell me what is that?
Salt.
Okay. Okay. And what is this?
Sugar.
Okay. So we know that he can taste between salt and sugar. Okay. And at this time, I will ask you to close your eyes, Mr. Petway. And can you tell me what is that smell?
Alcohol.
Okay. So I did his smell test and he did smell the alcohol, which is correct. And now I would get ready. Can you open your eyes, Mr. Petway? I'm going to look at your pupil reflex, and it's going to cause me to bring the pen light into your eye, and I'm going to look to see if your eye constricts. Are you ready?
Ready.
Okay, and eyes did constrict normally. And now I would check his extraocular motion, a movement of his eye. Mr. Petway, I would like you to look at this pen, and I want you to follow this pen. Okay. And we'll do it again without moving your head. And let's see. Okay, and we're just checking your eye movement to make sure that it's moving normally. Okay, and that was fine. Okay, and now I will go ahead and check his ears. I see no wax buildup. Okay. Tympanic membrane is intact. It's a nice pearly gray. Okay. Any pain in your ear, Mr. Petway?
No.
Okay. And this side is normal as well. Nice pearly gray tympanic membrane. Okay. Now this time I will go ahead and check his carotid artery. Okay. And I'll go ahead and assess his other arteries as well. I'll check his brachial artery. Switch arms here. And they are normal bilateral. And I will go ahead and check his radial arteries. Okay. His popliteal arteries. Can I get you to put your feet up here, Mr. Petway? And I'll go ahead and check his other arteries in his feet as well, which is his dorsalis pedis and his tibia. Okay, which is fine. And okay, you can see here. Okay, and now at this time, I will listen to Mr. Petway's heart sounds. First, we'll start with his aortic. His pulmonic. His tricuspid. And I will listen to his mitral for a full minute where I will get the apical pulse. Okay. I hear no abnormal heart sound. Now we'll listen to your lung sounds on your back. If I could just get you to turn your legs that way. Okay. Now we'll listen to his lung sounds. Okay, can I get you to take a deep breath, Mr. Petway, and blow out? Okay, out. Again. 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 Okay, can I get you to lift both your arms above your head? Deep breath in and out. In and out. Okay. And now, Mr. Petway, we're going to check you for tacular premise. And what this does is I want you to just say 99, and I would just go down his back to listen for any abnormal sounds. Are you ready? You ready? Start with 99.
99, 99, 99, 99, 99, 99, 99.
Okay. And then we have normal resonance. I didn't feel any abnormality. And now I begin the percussion of his chest sounds in the back of his chest wall. Can I get you to hold both your arms above your head, Mr. Petway? And I will do his long sound as well. Okay. You can hold your head, your arms down now. Thank you. And now I will get you to turn to me, facing me. And I will also listen to his heart sounds with the bell of my stethoscope. And we'll start back at the aorta. The pulmonic. The tricuspid. And the mitral. Okay. No abnormalities noted there, Ms. Petway. Can I get you to squeeze these two fingers for me? Grip strength is equal bilaterally. Okay. His skin is warm to touch. Hair distribution is evenly on his arms. No skin lesions or abnormalities. Okay. Look at your nail beds in the finger. I don't see any clubbing. They're nice and pink. Cap refills are less than 3 seconds. Any pain in your fingers or hands?
No.
Okay. Now, could I get you to squeeze my hands for me? Okay. Grip strength is the same. Okay. All right. And now we will listen to his bowel sounds in his stomach, and I just get you to lay on your back. This way it'll be fine. Okay. Bowel sounds are normal. And I go ahead and listen to his renal arteries while I'm up here as well. Listen for any brewing or thrills. And I notice none. I also listen to his iliac arteries as well. Everything is fine there. And I also listen to his femoral arteries for any brewings or thrills. Okay. And I also do some percussions on his chest as well. Can I get you to hold your arms above your head, Mr. Petway? And I'll do his side as well. Okay. All right. And can I just get you to sit for me? Okay. Okay. And now at this time, I will get Mr. Petway to stand. And I will have him to walk this way, normal. And I want him to come back facing us. Now turn toward me, Mr. Petway. Now I want you to walk toward me, but I want you to do it in heel to toe format. And I will assess his gait for any abnormalities. Okay, he's a little off balance. Okay, he's probably just sleepy. Okay, but other than that, okay. And let me ask you sit here. And what I want you to do here is when you sit, I want you to take your heel, like me, and run it up your leg, your right leg. Okay, and that is just a little off. Let's try the other side. Now, Mr. Petway told me he had a history of bulging disc in his back, and that's probably the part why he cannot effectively do the heel run. Okay. And can I get you to just lay here for me, and then we're going to assess your legs to see if you have any problem with your flexion in your legs. You stretch your feet out for me. And I'm going to check for plantar flexion. Mr. Petway, I want you to push your feet against my hands as hard as you can. Okay? And we're just checking for plantar flexion. Does that cause your back to hurt? No. Okay. Now I'm going to push your feet towards your knee. Does that hurt anything? And this is dorsiflex. And that's fine. Now I'm going to get you to close your eyes. And then I'm going to test your feet. You got to close? Okay. Is that dull or sharp?
Kind of sharp.
Okay. Okay. Is that dull, sharp, or soft?
Soft.
There is a Q-tip, and that is soft. Okay. Now I'm going to also check Mr. Petway to make sure he doesn't have any abnormalities when I flex his leg. Does that hurt? Got a little crepitus. But no, inflection is good. Okay. And extend. Okay. We're going to check this side as well. Does that hurt anywhere?
No.
Okay. Flex. Apt up. And add. Okay. Can I get you to raise both of your knees for me? Okay. That's fine. And we did check the dorsal-pedis pulse. We just do it running again since we're down here. Okay. We'll check the popliteal. The tibial, sorry. And we'll check the popliteal as well. Okay. Now you just get you to stretch your feet out for me again. His toes are evenly aligned. Okay. No abnormalities there. Can I get you to wiggle your toes for me? That way. Okay. All right. And can I get you to sit back for me on the bed side of the bed? Okay. And let's see. And I'm going to check your range of motion of your hands. Can I get you to extend your arms above your head? Can I get you to reach out for me? Now reach forward toward me. And range of motion is fine. Okay. And then I will check your range of motion in your fingers. Does anything hurt when I do that?
No.
And then I check the range of motion in the wrist as well. Okay. A little crepitus, but they move evenly aligned. Okay. And now I will go ahead and check his reflexes. Now we'll check his brachial reflex. Okay, let me just get you to turn your arm that way. And then when I check it, you'll have a little twinge in this hand here. And that is normal. Okay. And then I also check his ulnar reflex. Okay. And we'll do this side as well. Okay. Okay. And then we'll do his knee reflexes. Okay. All right. And everything seems normal there. Okay. Now, Mr. Petway, I want you to close your eyes again. And I'm going to place an object in your hand. And I want you to tell me what the object is that I placed in your hand.
Something round.
Okay. And then as we check it for sternogenesis, and that's a coin. Now, what do you feel in this hand?
Like a paper clip.
And that's correct. This is a paper clip. And we're just checking to make sure that he doesn't have any abnormalities there. Now, can you open your eyes for me, Mr. Petway? Okay. Then could I get you to use your right hand to cover your right eye? Now, can you open your left eye? Now I have the eye chart. Can you tell me what do you see on this first line?
A, D, E, F, G.
What about the second line?
T, M, L, C, D, E, O.
What about the third line?
Z, N, C, M, L, T, H.
And the fourth line?
R, B, P, N, C, E, D.
Okay, thank you. And Mr. Petway was able to pass the vision test. He can name all of the alphabets on here. Okay. And that's fine. Okay. And let's see what we forgot to do on Mr. Petway. You have any questions for me, Mr. Petway?
No.
No question. Okay. And at this time, I think we're just about to conclude our head-to-toe assessment. And I just want to thank you for allowing me to work with you today, Mr. Petway.
Thank you.